Good afternoon, Professor. This is my response to the video essay question 3 on respiration. Firstly, inspiration or inhalation is a process of taking air into the lungs. It is the active phase of ventilation because of the result of muscle contraction. During inspiration, the diaphragm contracts and the thoracic cavity increases in volume. This decreases the intraalveolar pressure so that air flows into the lungs. Inspiration draws air into the lungs. Expiration is a process of letting air out of the lungs, including during the breathing cycle. During expiration, the relaxation of the diaphragm and elastic recoil of tissue decreases the thoracic volume and increases the intraalveolar pressure. Expiration pushes air out of the lungs. Now, in pulmonary ventilation, this is commonly referred to as breathing. It is a process of air flowing into the lungs during inspiration and out of the lungs during expiration. Air flows because of pressure differences between the atmosphere and the gases inside the lungs. Air, like other gases, flows from a region with higher pressure to a region with lower pressure. Muscular breathing movements and recoil of elastic tissues create the changes in pressure that result in ventilation. Pulmonary ventilation involves 3 different pressures. 1. Atmospheric pressure. 2. Intraalveolar pressure. And 3. Intrapleural pressure. Atmospheric pressure is the pressure of the air outside the body, or is basically the amount of force that is exerted by gases in the air surrounding any given surface, such as the body. Intraalveolar pressure is the pressure of the air within the alveoli, which changes during the different phases of breathing. Because the alveoli are connected to the atmosphere via the tubing of the airways, the interpulmonary pressure of the alveoli always equalizes with the atmospheric pressure. Intrapleural pressure is the pressure of the air within the pleural cavity, between the visceral and the parietal pleura. Similar to intraalveolar pressure, the intrapleural pressure also changes during the different phases of breathing. However, due to the certain characteristics of the lungs, the intrapleural pressure is always lower than or negative to the intraalveolar pressure, and therefore also to atmospheric pressure. It fluctuates during inspiration and expiration. Transpulmonary pressure is the difference between the intrapleural and intraalveolar pressures, and it determines the size of the lungs. A higher transpulmonary pressure corresponds to a larger lung. In addition to the differences in pressure, breathing is also dependent upon the contraction and relaxation of muscle fibers for the diaphragm and thorax. The lungs themselves are passive during breathing, meaning they are not involved in creating the movement that helps inspiration and expiration. This is because of the adhesive nature of the pleural fluid, which allows the lungs to be pulled outward, and the thoracic walls moving during inspiration. The recoil of the thoracic wall during expiration causes compression of the lungs. Contraction and relaxation of the diaphragm and intercostal muscles cause most of the pressure changes that result in inspiration and expiration. These muscle movements and subsequent pressure changes cause air to either rush in or be forced out of the lungs. Now, with a regular respiratory cycle, a regular sequence, in general, 2 muscle groups are used during normal inspiration: the diaphragm and the external intercostal muscles. Additional muscles can be used if a bigger breath is required. When the diaphragm contracts, it moves inferiorly toward the abdominal cavity, creating a larger thoracic cavity and more space for the lungs. Contraction of the external intercostal muscles moves the ribs upward and outward, causing the rib cage to expand, which increases the volume of the thoracic cavity. Due to the adhesive force of the pleural fluid, the expansion of the thoracic cavity forces the lungs to stretch and expand as well. This increase in volume leads to a decrease in intraalveolar pressure. creating a pressure lower than atmospheric pressure. As a result, a pressure gradient is created that drives air into the lungs. Thank you, Professor, and that concludes my video recording for respiration.